And
All right,
we're recording.
we're recording.
Yep.
So good evening and welcome to the April 28th COVID-19 focused meeting of the Needham Board of Health. I'm Rob Partridge, Chair of the Needham Board of Health. This open meeting of the Board of Health is being conducted remotely per the Governor's Executive Order of March 12, 2020 due to the COVID-19 pandemic emergency and is being recorded. Public access to this meeting does not ensure there will be public participation unless required by law. Public comment at this meeting is not anticipated. I will introduce each board member and each participant on the meeting agenda. Please respond by saying yes when your name is called. Kathleen Brown.
Yes.
Ed Cosgrove.
Here, yes.
Steve Epstein.
Yes.
Christina Matthews.
Yes.
Okay, and for other members, Talib,
Yes.
Tiffany,
Yes.
Mara,
Yes.
Hannah Whitehead,
Yeah.
Amy, Carol Reed,
Yes.
Mary Fontaine,
Yes.
Lynn,
Yes.
and Kristen Scoble.
Yes.
Great, I think I got everybody. So I'll open the meeting, and the first item on the agenda is the board reorganization. So we have a new chair, and I'm looking for a vice chair.
I nominate Christina Matthews.
Thank you.
I'll second if you want that.
Sure, I'd be happy to do it.
Okay, and I guess I should ask, is anybody else interested in proposing a nomination? Okay, so we have a nomination and a second. We'll vote by roll call. And I'm just going to go around based on who I can see on the Zoom here. So Kathleen, for Christina for vice chair.
Yes.
Steve? I didn't hear you, Steve.
Yes.
Thank you. Ed?
Yes.
Christina?
Yes.
And Rob is yes. So congratulations, Christina. That's great.
Thank you.
Okay, so that being settled, we'll get to the COVID-19 update. We have no minutes to review, correct?
No, we were going to review the minutes at the regular meeting. So we'll have both sets of minutes at the next board meeting. The regular board meeting and this COVID focus meeting we'll review at the next board meeting.
Okay. So we'll move to the COVID-19 update and discussion.
Sure, thank you. So we have a couple different parts of our COVID update and discussion. I think we can sort of maybe start by going through part of the Board of Health packet. And Rob, you saw this in your new function as sitting on the Joint Health and Safety Committee this week. But looking at maybe briefly Needham level data and then sort of discussing whether there's particular changes. I'll briefly go through it, and then Hannah Whitehead is here. She obviously is our epidemiologist, and she puts together these slides, which are really helpful to us. So I think briefly, I was a little nervous a few weeks ago at the sort of direction the state had gone. There were 2 weeks in a row where the number of communities in the high risk category had increased. Needham had been sort of hanging around at 18.6 or 18.3 for about a month. Needham is now down quite a bit in the numbers that are released tomorrow. Tiffany or Hannah, I don't know if you guys know exactly, but you think we might be not quite in single digits, but maybe around 10 or 11?
Yeah, so we'll pull the report this morning. It was 47. So that'll put us at about 11-ish, 12-ish. And our infection rate will be below 1. Or our positivity rate, sorry.
Great. So Needham has been trending down. I think that's a real positive. When we look at the confirmed cases, we would expect to see, given the vaccination rates, and we'll come to that a little bit later in the slide deck, we would expect to see fewer cases on the older age spectrum, the people who've been eligible for the vaccine the longest. And that's what we do see here. We see school age children and maybe in the young adult category as the two largest categories. We have Hannah every week break down for us in a little bit more depth where within that school age children the cases are, and we can see that for the most part they're in the elementary age. I think this is going to be important for part of our discussion later about the Department of Elementary and Secondary Education recommendation around quarantine. You can see our age breakdown over the year, and you can see obviously a very clear sort of trend of declining cases over the spring. We've looked at this slide a couple times at previous meetings. It's the percent of cases within a population group compared to that population group's share of the total town population. If everything were equal, we would expect the orange to equal the teal. And you can see that there are areas where the disease burden is disproportionate to that group's share of the population, and particularly in the young adult, high school age and elementary school age children. Jumping a little bit further into that, we can see that it is actually pretty clearly across the age spectrum. I'll jump just a little bit to look at 3 slides in a row. Our average daily cases for Needham and the surrounding communities. This is over the course from the summer through now, and you can see sort of the very distinct pattern of the sharp increases in Thanksgiving and December holidays, and sort of a secondary peak in some cases in late January, early February. When we look at it over the last couple of months, though, you see sort of a very clear downward trend over the last 2 months. And when we sort of sort out the noise and we just have Needham's average daily incident rate, you can see that we've been fairly steady in our downward trend over the last few months, which is a real positive. I want to jump briefly to the county and state data, sort of the same 3 sets of slides in a row. Sorry, the same 2 sets of slides. So this is over the course summer to now. And you can see sort of the last 2 months, a not quite as clear trend as we had when we looked at Needham, but still a downward trend, especially after the early April sort of flare in Suffolk County. When we look at average daily case rate, percent positive rate, it mirrors sort of the same trend. Hannah, do you mind taking over for the vaccination coverage? Just going through that vaccination coverage briefly.
Sure, yeah. So this is looking at Needham's population, how many people have been vaccinated so far. This is as of last week, so we would expect that with the data that should come out tomorrow, these will all be even higher. But you can see that nearly 20,000 people in Needham have already received 1 dose, which is about 2/3 of the town. 43% are fully vaccinated, and then a quarter of the town is partially vaccinated. This is looking at this by age group. So you can see the bars break down within the age group, the numbers that are partially vaccinated versus fully vaccinated. So you can see in the older age groups, the vast majority are already fully vaccinated. And as you go towards the younger age groups, it's a bit more of a mix. And then the black bars show the percentage that's fully vaccinated. So again, you see in the 75 and older age group, it's already well over 90% that are fully vaccinated.
Can I ask a question?
Yeah.
Is it possible to get those? So now we're really interested in who's not eligible. So is it possible to split out the 16 to 19 at this time?
What the state has been putting out is just, I think they don't break it out beyond 0 to 19, but maybe as there are more vaccinations in that group, maybe they will be able to split that up more.
Right now, Hannah, there's no way for us to tell how many essentially 0 to 16-year-old.
Not in the town wide, yeah. So that what the state puts out is just in these 20 and then 10-year age brackets. Sometimes they change how they're presenting the data, so it's possible that that could change, and I'll double check, but this is what has come through in the report so far.
Does the census data break it down any further, or is it still sort of a large age bracket? Okay.
No, the census data is a bit more granular, which is how we're able to look at the incidence rates for kind of these sub-age groups. But in terms of the data the state's putting out on vaccination coverage, they haven't gotten more granular yet. So this is just looking at the breakdown of vaccination coverage by race and ethnicity. These are just numbers, not percentages. As you would expect for Needham, the largest share is the white group. But the thing to see here is really that it's trending steadily up for every group. I don't think any population group has been like fully saturated yet, so this should continue to climb.
Hannah, this is not to scale, right? I mean, I'm looking at
No.
the white population, 10,000.
Yes.
And all the others would be minuscule by comparison.
Yeah, it is a dual scale graph where I've hidden that because yes, otherwise you wouldn't be able to tease out any of the difference. So obviously the white population is much larger than any of the other groups in Needham.
Okay.
Can I ask, sorry, another follow-up on this? So percentage-wise, we expect sort of non-white to be about 15% probably of the Needham population, right? Something like that, based on census. And so, like, are we finding these people for vaccination? Like what should we be doing to get these numbers up in these communities? Because it's a small fraction that seem to be showing on here, but maybe we're missing them. I don't know. But for all, it's a sort of global question. So
I could talk a little bit about what Hannah Burnett and our BC student nurse, Neon, whose last day was actually yesterday, sadly, they created a survey that then they sent to multiple different groups, community council, the faith council group, different like St. Joe's, St. Bart's, Temple Beth Shalom, all the contacts we could think that weren't necessarily all town of Needham contacts that they could push out to their residents, their people that come, so that we can kind of see who, how, where, and when. So far, we've gotten about 150 of those back. And so that's good. So teasing out that data, hopefully we'll be able to give us some idea of what, but I haven't fully looked at the data, so I'm not sure exactly what it presents at this current moment in time, but that's the next step.
okay, thanks.
There's also, I think there's not a huge, but a reasonable percent of people that are classified as other/unknown. I think it's about 6%. So, obviously it'd be helpful to know who comprises that group.
And part of it too is we've been trying to figure this out, Hannah, Tim, and I, about how to show the percentage rate instead of the total percentage, but we don't know how many are children, right? We don't have that data that we know of that. So we don't know, unless it's high up on the percentage rate, then we know that lots of people are adults. But if it's low, we just don't know if that's contributing because they're children or because we're not getting to them as well either. So all things to work on.
So put another way, we don't know, for example, of Hispanic residents, if a larger number of Hispanic residents are younger versus older, and therefore the younger residents might not be eligible for vaccination. I know we have been trying to figure out a way to tease that out, and we haven't come to too much success yet on that front. The last two slides, just briefly, are things we've presented briefly before. Needham is a well-resourced community with residents that are predominantly in jobs with paid time off and may have access to private vehicles. So Needham residents compared to the state in terms of fully vaccinated, Needham exceeds the state in all categories. When we compare Needham to some of our surrounding communities, Needham or Newton would lead each of the pack in terms of vaccination amongst the different age groups across those towns. That's not particularly surprising, again, as Needham is a community with a lot of resources, and the residents here often have, jobs that might give them paid time off, and like I said, access to a private vehicle or something that would make it easier for them to access appointments. I'm going to stop sharing briefly, but I think it's important for us to sort of keep that in mind. And I think vaccination coverage in Needham is something that's going to be important as we talk about two of the sort of major issues today, which is the outdoor, the governor's announcement yesterday about a number of changes to state requirements, and an earlier announced late last week change that the Department of Elementary and Secondary Education announced sort of with DPH. I included in the board's packet a draft of a revised facial covering order. One of the major changes that the governor announced yesterday was that effective on Friday, April 30th, mask coverage or facial covering would not be required in an outdoor setting as long as people were able to socially distance. That's a departure from what's in place right now at the state level. Right now, the expectation is in an outdoor setting that you would be masked. The governor's office did say that there is some gradations depending on sector specific guidance, but that generally for a resident walking down the street or a landscaping crew or sort of people out in the community, that basically you would be able to walk around without masks on. The other major announcements that were included, and I did include the press release in the Board of Health's packet, were a series of changes throughout May to revise some of the occupancy or total number restrictions on different types of businesses. And then sort of the other major headline was if vaccination coverage continues in the way it has been, as well as the case volume and positive rate continue to decline, the state announced that it anticipates on August 1st, there will be no COVID related restrictions of any kind on businesses in terms of occupancy limits or anything like that. The board currently does have a mask order in place through June 30th. One of the options for the board is to revise that order if it so chooses to align more closely with the new state guidance that's going to be effective on Friday.
Which is pretty much what we had before the state changed their guidance, correct? Yes. We only changed our guidance to kind of bring it in line with the state so there was no ambiguity.
Correct.
Right. The other thing I'm noticing here is if you look at our numbers, our vaccination numbers, I know you've got a line kind of where we have the percent fully vaccinated, but the partially vaccinated by age group is actually quite high once you hit 20 years old. So the 20 to 29 year olds are 72%, the 30 to 50 age group is 83%, the 50 to 65 is 86%, and it keeps going up from there. So, if you consider that 70% is where you kind of need to begin to get herd immunity, the vast majority of people at least have some protection at this point, and hopefully people are getting their second shots, but even if they don't, we know the vaccines are largely 80% effective after even just one shot. So we're getting there. I mean, we need to focus obviously on the under 20 population and getting their vaccinations up, and that's going to be pretty limited because it's only approved for 16 to 20. Right. But yeah, I mean, I think it's going to be pretty reasonable for us to relax some of the restrictions given the reality on the ground for our town.
Yeah, I agree with Steve.
Yeah, I agree too. I mean, the numbers that were presented are very encouraging for the first time in quite a while, and not only declining, but also, the vaccine acceptance is really good. And
I don't think we have too many anti-vaxxers here.
Vaccine hesitant, right?
Well, the CDC did put out a study on vaccine hesitancy by state, and Massachusetts had the least percentage of its population that had hesitancy about vaccination. So that is a positive.
Yeah.
And I think selling the benefits of being vaccinated, is the next job, right? So you get to do things like travel and not get a PCR test when you come back. I think the question is, the governor even said in the press conference yesterday, August 1st, no occupancy requirements. He still expects to be masking, which I mean, when we've got 90%, I don't know, it needs to be discussed, and then what that means for school next year and things like that. I mean, I think there's going to be a lot of shifting in that area. But yeah, I think so. Our order, what we did at our last meeting, I think already matches what the governor did, correct, on our order?
Yes, I believe we had previously had in place you need to have your mask on outdoors unless you can reasonably distance. The state had made a change it's basically to say you had to mask at all times. We would be restoring what was sort of originally the language of masking indoors and outdoors when you can't maintain distance. And if the board wishes, it would, take effect at the same time the state would on Friday, April 30th. Right now, the board's order isn't in effect till June 30th. The board has the ability to be stricter than the state, although, as I think you've indicated, the data is squarely on the side of the safety of the supermajority of outdoor activities.
I'm with Kathleen. I thought that we had adopted that at our last meeting.
I did too. That's why I'm confused.
Ordinance, while the state, and in preparation basically for when the state decides to relax theirs, we are already in sync.
Sure.
Did we not take that official action last meeting?
We did. So the board can choose to keep that language. The board can choose to change that language. There's a few other minor changes, but that's the substance, whether the board wants to keep the language it has now, which is when the state makes the change would take effect of outdoor masking only when you can't maintain distance from someone else.
Yeah, I mean, I think that makes sense. I think the state has done well, and certainly Needham has done better even than statewide average. And I think I'm comfortable with going with that language. In other words, if the state relaxes the regulations, then our regulation should be concomitant with the state's at the moment the state relaxes it.
Okay.
It should match up.
Okay.
So Tim, the language that you inserted in the town order, which is I guess the last page of those signatures on it, starting with the emergency order does not require the word, that would basically match what the state is doing.
Yes, it would match what the state is doing. The only change actually from the board's existing regulation is the last sentence, notwithstanding the preceding sector-specific guidance and other state limitations on gatherings may apply to certain types of events. So I think it looks like it's all inserted, but really it should only be the last sentence that's a new track change.
Right, but Tim, the sector-specific guidance, that's really from the state, right? So
yes.
Does that really apply to our town regulation? I would think that we'd want to leave that out of the town regulation, leave that up to the state. Because we are not specifying sector by sector as a Board of Health.
That's true.
What the restrictions would be.
Okay. Yep, we could make that edit.
Do we need to take a vote on, if we take that sentence out, do we need to take a vote on that language?
I think we should.
It would be helpful if the board took a vote and we can sort of clean up some of the effective this state elements. But we will remove the last sentence.
If we remove that sentence, are we actually making any changes to what we just did a couple weeks ago?
The only changes, as best I can tell, would be relatively minor changes related to dates, as well as distinction of whichever is fewer, which is no longer applicable given the state's guidance. So most of the other changes are sort of pro forma. Every time you adopt it, you've got to say we adopted it this time and effective this date and that sort of thing. So the changes would largely be perfunctory is probably not the right word, but the changes would largely be cosmetic. I do think it's potentially helpful that the board, if the board takes an affirmative vote and concludes that outdoor activities are definitely safe, and that people who can do them while distanced shouldn't have to have a mask on. They're
So-
probably, go ahead, Tiffany.
Sorry, can I just, the reason we put that last sentence in there is because the state has the caveat that that does not count for outdoor events. So I don't know that we need, I think we still need to have a sentence in there that may say, according to the state requirements or something, so that they know we're not being more lax on our requirements versus what the state has. Because there are still instances where even if it's an outdoor activity and you can still be distanced, you still have to wear a mask.
Right, but that would be covered by the state. I mean, sure, we can put that in just for the sake of removing any ambiguity. But if somebody were holding an outside event, they have to follow both. They have to follow the state guidance and the town guidance. In this case, the state would be the stricter. They'd still be bound by it, even if we did not specify that in town regulation.
That is correct.
Chapter 111 allows us to go, more strict, but not more lax.
Yes, but this shows more lax if you don't put that in, doesn't it? Doesn't it show that they can be outside if we don't put the caveat from the state within this? So I still think something needs to be in there so we don't confuse people that's saying that if our guidance doesn't meet it, it meets the state guidance instead.
I think it seems like a helpful line to actually have in there.
Yeah, I agree.
I think Steve's point, you're saying, Steve, it might be more appropriate as like a footnote or as an addendum or something rather than in the text of the order. Is that?
Exactly.
Okay.
I agree. There needs to be something there.
Yeah, that's fine.
Okay. So we can modify that if the board wants, and we can put that as either an addendum or a footnote, saying that there are sector-specific requirements still in the state guidance that wouldn't allow you to always have your mask off in all circumstances.
Yeah, all right.
I was going to say I had an inquiry this week from the Pool and Racket Club, and they interpreted the state rule as for the tennis players that they were able to take off their masks completely. So I clarified with him, like, that wouldn't be a situation, or I wouldn't encourage members just because they were outside not to have their masks, still encourage wearing their masks, especially when they're not socially distanced. So I think that sentence would help clarify things.
Doesn't the state, well, I guess that's youth sports, right? I mean, for singles tennis, you're not required to wear a mask in the state sports guidance.
Right, although for
One of the
doubles.
few. What's that?
Right, for doubles you'd have to, but for singles you do not.
Golf, like I guess you're allowed to not wear, which makes sense if you're.
I can
just
see
didn't
that.
want them to send like a blanket email telling everyone, like, just because you're outside, you don't have to wear a mask. Like, I want them to be cautious and understand like what situation is appropriate versus what isn't.
I certainly think this is, there is good news here that vaccination rates are up, that cases and percent positive rate is down. I do think it is a more nuanced message that we have to convey now, so that my team will have to obviously do some work as well as work with Cindy, the town's public information officer, to make sure those messages get out there.
Yeah.
I wonder if we might want to clarify the household gathering, because that piece hasn't changed, right? It's still 10 indoors. I wonder if we might want to just include a reminder of that.
Okay. I don't have the text in front of me right now, but or I don't have the state text in front of me. I have our text in front of me.
But events are going to be much bigger very soon.
Right.
Day weekend. Yeah, I don't think indoor gatherings have changed. It's events. And you can
The
see
numbers at indoor gatherings will rise shortly, though.
Yeah, May 29th, 200 people indoors, 250 outdoors for events.
You're
public weddings,
talking
and private
wedding
settings.
receptions at that point.
Mm-hmm.
will say state of Vermont is not counting vaccinated people towards head counts for events.
Oh, that's interesting.
Yeah, very interesting.
Hmm.
There are two other sort of COVID-related topics that we do want to hit, Mr. Chair. So I don't know if the board wants to take a vote on this or to wait to discuss the other topics and then take a
No,
vote.
I think we should. Well, I'll shut up.
So I think I just need a motion to accept the language that's in the town guidance, and including the notwithstanding statement, either in the same paragraph or as a footnote.
Yes.
Okay, I'll make that motion.
Second.
Good enough.
Okay. All right. So why don't we go ahead and vote on that? Kathleen,
Yes.
Christina,
Yes.
Steve,
Yes.
Ed,
Yes.
and Rob is yes. Okay, so that's adopted. Okay, so that's done. So Tim, did you want to move on to the next couple bullets, which are possible revisions in distancing?
Sure. If I could, I'd just set the table, and then I think Tiffany and Mary and Amy might jump in a little bit more for the next two topics. On calls last week, the state holds 2 calls a week, usually on a Tuesday and a Friday. There was an additional call on a Thursday with some other health directors. The Department of Elementary and Secondary Education announced on the DPH call with local public health that the state, they originally announced that the state was changing who was defined as a close contact, only in school and buses to school from school settings. They then refined that after people sort of pushed back on that to say they weren't changing the definition of a close contact in school or on the school bus, but they were changing the recommendation that people who were under 3 feet would be defined as a close contact and would have to quarantine. Between 3 and 6 feet would be a close contact, but would not have to quarantine if the exposure was in a school or on a school bus. And if it was over 6 feet, obviously they would not be a contact and would not have to quarantine, as is the case now. The state further clarified, which I think is not really clarifying, that this doesn't apply to buses to like an athletic event, even if it's a school-sponsored athletic event. It applies to history class, but not to Model UN, which might be 20 minutes later after the final bell rings. The Model UN club in the same classroom, it still has to be 6 feet, not 3 feet. So it sets an odd sort of double standard. The state EPI I think specifically did not say these words. The Department of Elementary and Secondary Education did, and they said it was a decision from the command center. To me, that usually means that there's some disagreement behind the scenes and DPH has been overruled on things. This is an area where the Board of Health could be stricter, or the Board of Health could work with the schools to adopt a stricter standard. But I did want the board to have some understanding and discussion about the questions about 6 feet versus 3 feet. Mary or Tiffany, do you want to sort of pivot and then call on folks for the chart that was put together by the team?
Sure. Mary and her team, Amy, Isabella, and Jessica, put this together, which is super helpful with all the footnotes and everything of where the guidance actually comes from. And I will let Mary take over. She's going to introduce Amy, so you know who one of our awesome contact tracing staff members we have with us, and then they can kind of go over what they did with the background and then move into the next section as well of the reinfection rate.
Yes, so I have, I think as you guys are aware, we did hire 3 part-time contact tracers to assist, which has been especially lovely as the case rate has dropped. So we've been able to give them some additional tasks such as this. So this was actually done before the state clarified that they weren't changing the close contact definition to 3 feet. So that's where the slight discrepancy is on the DESI. So Amy is one of those 3, and she's on tonight. So I had her come in. She's a MPH graduate from BU. I promised her I wouldn't throw her under the bus, but she did want to come in and be a part of this. So the chart that's Tim put in the packet sort of delineates what the guidance is from the 4 different government agencies in terms of who says 3 feet and who says 6 feet. And I think the takeaway here is that there's a lot of evidence. I strongly recommend, if the board has an opportunity, the DESE policy. I personally went through all of the footnotes and I read all of the articles that they quoted. And I'm not really going to take the time to go through that here, but it makes a very strong case for 3 feet of physical distance. I don't exactly know why they would limit the quarantine. And I think that would be a good thing for if the board has an opportunity to maybe in your free time, if that even exists, to kind of peek through what the studies are that DESE is actually trying to draw from when you guys are looking at this. But the takeaway here is that the CDC pretty specifically says, even if schools choose to go with less than 6 feet of guidance, that 6 feet is still required for quarantine. Really the only agency that said otherwise is DESE. That CDC guidance is actually footnote 15 on the DESE policy, where it states that. So what we have is CDC does say that, you know, there's some usage for 3 feet of physical guidance specifically in schools, which is followed up by the state of Massachusetts. DESE is kind of built upon that and then restricted quarantine to just individuals within 3 feet. And then, and that's only in classrooms and on school buses. And so everything else that we still have right now is pretty much talking about 6 feet. And then that's the breakdown here is who recommends 6 feet of physical distance and who, what policies are talking about 3 feet. And then the second page here is the resources that my team used to make all of these, so that you can then also have the opportunity to see where all the different guidance is being pulled from.
And do we think that's because DESE feels that they don't have jurisdiction once the kids are out of the classroom?
Well, the answer that was given in part on the conference call was that essentially they really want kids in the classroom all the time, and they don't really care if they're playing soccer or in Model UN. So they don't want quarantine to apply to kids that might keep them out of school, but they don't care about extracurriculars. That's actually what the DESE person said on the state call.
And I think it came out of practicality. I mean, they were, you know, quarantining the whole class basically when you get one case. Almost. So.
One of the things that the board knows is there was the public health team, predominantly Tiffany, Mary, worked with the schools because their original guidance, the school sort of MOU with its staff, basically said that anyone within a classroom of a COVID positive case would be considered a close contact. We said that didn't really make sense. So there was a sort of a distinction for a long time of you were excluded from school, but you are not technically in quarantine. The schools worked with us. It did take a while, but they did eventually sort of change their process so that it aligned with public health guidance, which was appreciated. It made it a lot easier to communicate to parents and students. I think one of the challenges, at least for us here, is that sort of any other type of activity, if they're playing soccer, if they're hanging out with their friends, is 6 feet, you have to quarantine. Within 6 feet, you have to quarantine. This obviously creates a different standard within the school and school bus environment. And there's certainly that will be a more challenging thing to message. That there's in this instance, it's one thing, and in that instance, it's another.
I think it's also going to be a little confusing at the beginning because we still have to notify those who were within 6 feet as well. We don't just notify those who are 3 feet. So everybody who's within 6 feet has to know they were a close contact, but only those within 3 feet have to quarantine. So that's going to make it a little bit difficult messaging, I think, for parents to kind of tease out and understand or read closely because they've been used to the same message for a while. So we'll have to work through that as that comes as well.
I think it also raises some problems in terms of HIPAA, in terms of these people, because parents talk. It makes it very obvious pretty quick exactly who the individual is if we're only quarantining within 3 feet. So then, oh, I got the 6 foot letter, I got the 3 foot letter. Okay, well, who sits on the other side of Johnny from my kid? And so from a HIPAA standpoint, I think it's also going to make it a little bit more difficult to actually maintain the privacy of the student.
I think it's definitely confusing. I think if we take action on this, it seems like we need to not only make sure we have the right messaging, but also just be consistent. I think the inconsistency is going to be a problem for the reasons mentioned.
Yeah.
And is it our job to do? I mean, isn't this a school department decision?
So the schools in the joint health and safety meeting on Monday did ask us to try to give them some additional background and information. They found the sort of 2-tiered system to be very challenging on its face just to consider. I think it made some staff members nervous. I think the board can certainly make an order with sort of its public health guidance, or we can make a recommendation to the schools, which I think they'd be honestly fairly eager for the board's opinion on the topic, or the board could discuss it in more depth. I think the challenge is that this was announced right after the end of April vacation. The schools are now at full capacity. Everyone is back in person. As I explained to this joint health and safety committee, I prefer, changing one variable at a time. So if you're going to put more kids back in the classroom, let's sort of keep all the other thing constant for, 2 weeks and then introduce another change and keep everything else constant, just in terms of sort of managing situations. So I think the schools were they've been quite busy over April vacation, getting everything ready to have everyone back full time.
So maybe we can make a recommendation.
Can I do?
I'm going over this paper that was put out about the 3-foot distance, and I think it's worth actually looking at that. And what I'm seeing in this, at least, is where they got their data from is kind of interesting, because they obtained the data on positive cases in the kids. Basically, they said there's mandatory case reporting to DESE is required only for districts with any in-person learning. So it assumes that those kids were actually tested. And we know that a lot of kids, at least here in Needham, just were never tested, right? So it's one of these things, again, that, yeah, they didn't find anything at 3 feet, maybe because, guess what? There was no testing. It's lack of data. It's not that it's negative, and they just don't know the answer to that one way or the other. There's no way they could, based on the data that they had available to put this paper together. So I don't know. I agree. Having the 6 foot and the 3 foot is going to be very confusing for the schools, for the parents, for the kids in particular, who probably are not going to abide by varying standards.
I mean, a case. So what's the average case? So how many of our close contact? We've had hardly any in school, right? That people that are quarantined from a contact in school, both parties masked, right? I mean, I'm just, you're getting everybody back to school, and now you're going to have all these kids sitting at home. Maybe, I don't know.
Is it though? I mean, we've had stricter standards in place. Sorry.
Yeah. No, go ahead. We've had few cases, I guess, in the last few weeks, but.
So in the schools, students' desks are at least 3 feet apart. In very few cases are they 6 feet apart. They work to get them as far apart as possible, but they're all more than 3 feet apart. So I think the practical implication of the guidance is that if there is a COVID positive student, no one in the classroom is quarantined.
Okay.
If we went with this guidance.
That's a good visualization. Thank you.
Yeah, normally
Okay.
with the case right now, if I was sitting in the middle, then the person in front of me, behind me, to the left and right would have to quarantine, because those would be, 4.5 to 6 feet away from me.
The HIPAA thing's a good argument. I mean, of course, they're all going to know anyway, but I think, right? I mean,
Well, if they really are more than 3 feet apart, then we won't have to worry about it. We'll just have to notify everybody they're at close contact and not 6 feet. So as long as the classrooms actually stick to the greater than 3 feet, then nobody's going to need to quarantine. So we'll just send one letter, which will decrease that HIPAA concern.
that's interesting.
With the addendum that that's only in the classroom, it's not in the lunchroom, it's not in gym class, it's not at recess. So there would still have to then be, there's no close contacts in the classroom, or, there's no need to quarantine from the classroom, but there's still this other list of children who were close contacts on the playground in the lunchroom.
Yep.
But that wouldn't change that. I mean, this rule wouldn't change that. You still have to run those down, right?
Right, but this would then require us to send out, so we'd still be sending 2 letters. One is you were a close contact from a classroom, but you
When you
don't have
don't
to
need to
quarantine. And
quarantine,
then
yeah.
you're a close contact from elsewhere in the school and you do have to quarantine. So it's, we don't have anything right now where we issue you were a close contact, but you don't quarantine. Unless somebody has a condition that they're fully aware of, they're fully vaccinated, or they're a prior positive. And so this does still create a new category of contact tracing.
I think this is going to require some further discussion. We have a number of other items on the agenda that we need to get through in 10 minutes.
I mean, is the school department needs it I mean, they need to make decisions this week. Is that
Yes.
Yeah. So I think we need to decide this.
if class is happening right now? I mean, everybody's back. I don't know what else to do.
If the board wanted, it could certainly make a preliminary recommendation and then, either at its next meeting or at a specially called meeting, discuss in more depth, or the board could, because Rob as chair participates in the Joint Health and Safety Committee, the board could sort of empower Rob to act on its behalf after more discussions with the schools, or there's sort of a number of options the board could pursue.
I mean, I'd like to have some time to actually review the papers that they're basing this on, because some of these are technical and I can't do that in 5 minutes while we're all trying to discuss something else.
Sure.
Yep. There is actually no health and safety meeting that's coming Monday because of town meeting.
Yep. So we have a little time.
But in the meantime,
Well,
in the meantime, we need to know what to do, the nursing team and the contact tracers, because otherwise we'll default to what the state says with the DESI guidance. So if there is a recommendation somebody wants to make now, then okay. If not, we will utilize the state guidance.
Steve, what papers are you looking to review? Because these are all just guidance documents that are referenced.
The original one from Polly Vandenberg.
Oh yeah, that's not a great paper.
Well, that's the paper that all of this 3-foot stuff is based on. And as you said, it's not a good paper. So if it's not a good paper and, the state is going against CDC guidance, as an interim measure, I mean, maybe I'll just, throw out as a straw here that we go with the CDC guidance on this as a town, and we say it's going to be 6 foot uniformly until we can further review the data, because that's erring on the side of safety for now. We're not saying that it's a permanent thing. We can actually just hold this over till our next meeting, and then it'll be rescinded if we don't come to some sort of conclusion at that point. So it'll be time limited, but it's going to provide some consistency at least for contact tracing and for the town until we can get our hands around this. And I think it'll stand up to a challenge, frankly, under 111. But even then, they're not going to be able to challenge it that quickly and take
I
us
don't
down.
know. I'm so sick of this.
I think certainly the superintendent, from what I've heard, and Tiffany or Mary, you could please correct me, Barbara Singer, who's the director of school health services. I think they'd appreciate that in the interim, that there would be some consistency, and yes, it could be reevaluated or should be evaluated further. I think they might appreciate that just for a 2-week period, or until the board's next meeting or something, that we're saying it should maintain at 6 feet.
Yeah, I mean, it's a quick turnaround and it happened at the end of vacation. I mean, I think it's, I think it's fair to do that. I may hate to have a bunch of kids in quarantine that don't need to be, but it's also probably the most careful route ahead, at least for now, till we can decide otherwise. I don't know.
I think it's reasonable, and then at least we're consistent, and the public health group is all doing the same thing, so we can sort through this a little bit better.
Yeah, I mean, it seems unlikely that a parent is going to fight to say my kid doesn't need to be in quarantine. They were actually 4 feet away and not 3. You know what I mean? I think most people would, well, maybe not, would want to err on side of safety, but maybe not.
Yeah, I just want to avoid, parents getting, 2 letters, one of which says you have to quarantine, the other says you don't have to quarantine. And they're like, well, now what? What do you want us to do? It's like, well, you do and you don't. It's like, that's crazy.
All right. So is the board comfortable with that message then that Steve outlined?
Yeah.
I think so for the next couple of weeks. I do worry about some pushback from parents, because I think folks are so happy to have kids in school finally, but I think it makes sense for the interim.
Okay. Well, with that, let's move on. In the last few minutes, we have quite a bit to get through. I think first is the reinfections.
Mary or Amy, did you want to start that topic?
Yeah, so this is me. This is something I noticed a few weeks ago. I had a parent call the school and was referred to me to say that their child had tested positive for a second time. And I didn't have a notification in Maven. I couldn't find them in Maven. They didn't show up on any of our reports. And I was concerned this was a glitch. So I reached out to the ISIS help desk and had a conversation with them. And I included the email explanation I eventually got there in the packet. So I've got 3 slides that I put in here for you, just so you have an idea of what's going on. The first is a case that I tried to redact as much information out of it that I could, just showing that when they were positive the first time, when they were positive the second time, based on first Tiffany's note and then mine after. And you can see on the left-hand side, it's got the date on it. It still reads as being at the end of December. So what happens is if you're previously positive within the year, they don't update in Maven to being an active case. They don't show up on our reports. As of right now, there hasn't been a change to that. This individual, I even put up the labs so that you can see when they tested positive for the second time, and that it just flat out doesn't update. And that isn't something that they're looking to change at any point in time. So my concern that I just wanted to kind of bring up here for the board is that I'm not being notified. Nobody is being notified, Needham or any other town, by Maven when we've got someone being reinfected. So a second infection that happened within the first year after the first infection, Maven doesn't generate notifications. And not only does it not generate notifications, it also doesn't show up on any report that I've been able to run. I asked Hannah Whitehead to kind of look in on this with me too, because she's had good luck in pulling data from Maven reports, and we haven't found any way to actually find this. So the only way I know when we have someone with a second positive, a reinfection, is when they reach out to either the school or they've talked to me before and they saved my number. So I have reached out to the Maven help desk. I haven't gotten an answer yet. I don't know how bad this is. I don't know if this actually has an implication on the state numbers. but it is something that I found, and it is something that is bigger than me. And so I kind of wanted just to make you guys aware.
I think it's going to be bigger than us too. I mean, you're talking about making a reporting change, but it might be something that you know, our state reps might be able to be helpful with, particularly Denise, because she's on the public health committee. Because I think she'd take it, you know, as a nurse, she would take a real interest in this, particularly because we're seeing variants, and if people are having breakthrough via variants, we might not know that it's a variant. And you know, I don't expect them to do molecular testing on everything, but we'll at least know that we've got, you know, second positives, because otherwise we could have a lot of people running around who are positive and we'd never know it.
How was this person tested if they're asymptomatic?
They were returning from travel.
Okay. Because I've only seen one case of a reinfection of somebody who had it more than 3 months before, and we thought probably a variant. They were from out of the country.
So this was returning from travel.
In the short term, it seems like, you know, really the only way we're going to get this is with self-report. So, you know, messaging, encouraging people to say to either the Board of Health or to the schools that they've had a positive test.
So do you get a unique identifier for the person? You do, right? I mean, you could look at people, I mean, if you can pull all the data and then calculate how many observations per person, there should only be, I mean, you should be able to do that through the data. But I mean, it would take some time, right? Where's Hannah?
Well, I think my point is
does.
they're not updating. So just looking at this at a glance, it shows that this is a case closed from December. So you'd have to physically go into the case file and open up the lab history to have any idea that they tested positive again. It doesn't show on a report, and it doesn't show on last test. There isn't a report that pulls last test or most recent test. It's just first. And so there isn't a quick way, or even you physically have to go into each different event file individually and look at the labs in order to find them.
Okay, Hannah and Tiffany will talk. We're going to talk about that.
Yeah.
Interesting. I wonder if there's a data solution for this, but yeah, or talk to the state reps about better reporting, because this is actually crucial if people are being reinfected and nobody has any idea. It's crazy. Thanks for pointing it out.
Yeah, thank you, Mary, for going over that with us.
Yeah, and this information, just so I'm aware of, because we're in a public meeting, this is in the public domain at this point, right? What we're discussing here.
Yes.
Yep.
Okay, thank you.
Okay, so we're bumping quite significantly up against time. And
Yes.
we have annual and special town meeting information to discuss.
Sure. So weather permitting, annual and special town meetings are Saturday, May 1st, Sunday, May 2nd, and the afternoon evening of Monday, May 3rd. There's a couple items that the board may be interested in, and I tried to highlight in the appendices of the different warrants, those items. I know that Ed wanted to bring up one in particular from the annual town meeting warrant, which is in the annual town meeting warrant, there's the set department revolving fund limits. That's largely uncontroversial, although Health and Human Services has a number of items in there. But Ed wanted to bring up the citizens petition to amend zoning, which is Article 7 in the annual town meeting warrant.
All right, I received a telephone call from one of the select persons in town, and they were concerned about this citizens petition to rezone a section of Hunting Road, Kendrick Street, a couple of other streets in that area. It's basically where Kendrick Street and Hunting Road come together right at the bridge. And it's that bunch of properties between, I think it's Hunting Road and 128-95 and the ramp. And they're asking it to be rezoned from Residence A to Residence B because they're having problems with, some people at least claim they're having problems with minor changes to their house, like adding a porch roof, over front steps and things like that. And then they have to go for variances because the properties are all non-conforming to the residence A lot size. So they wanted to bring it more in compliance and in conformity with the lot size for residence B, which that's the way it's presented. It seems to be presented by the petitioners. The concern that one of the select persons had is that it's actually, there's a couple of people in that area who are considering or would like to reconfigure their lots or a couple of lots adjacent so that they could get more housing onto the lots which residence B would allow. And that would bump residences up closer to the edge of 128. Right now, that the residences are close to the road and they're pretty far back from 128. But if you reconfigure the lots, that might change. So this person was asking me if the Board of Health had any would have any input to make relative to this this petition based on health concerns, considering our concerns about the Modera complex that was built further down on Greendale Avenue. Again, we got them to somewhat change their original proposal based on the microparticles from 128.95 and so on. And then we also got some concessions relative to ventilation and windows. And of course, what this person on the selectmen said was, in a single family residence, you wouldn't probably be able to require the kind of ventilation systems and or windows, keeping windows closed on the 128 side, because people would just open them anyway. And so therefore, they would like us to oppose the citizens' regulation based on health concerns. I'm not so sure we want to insert ourselves necessarily into this issue. It's a zoning issue as far as I'm concerned, but I'm just bringing up what I was asked by one of the select people.
Well, one of the caveats with the Modera was that there was an interest in providing affordable housing, which is a public good, which to some degree mitigated the health concerns that we had in putting up the housing there. They got a lot of units, we got a lot of affordable housing. This would not expand affordable housing.
Right.
I don't know that we need to be out front and center on this, but I think that, if asked, we should certainly be prepared to speak to it. I would not be in favor of any proposals that would increase housing that close to the highway. I mean, I think we'd have to look at, again, at actual distances. But yeah, residents, as I looked at the zoning, and it's a matter of square footage, right? I mean, single residence B is much, much smaller than single residence A.
Right.
Although there are different setbacks now, because if they're non-conforming, they're going to have to conform to the new setbacks in B. So it's a little bit more complicated than I think they're making it. But I don't know. I mean, you'll be there, Ed. Rob, you are now a town meeting member. And I would say, if asked, you should certainly say that, there are health concerns with increased population densities close to highway. And, we expressed those concerns earlier with Modera, and there were concessions made, and we would be concerned that that did not occur here. Leave it at that.
I think that's it. I think that's a good way to put it. And that may be what we could say, is that as long as the existing plot arrangements and locations of housing goes, we don't have an objection to changing it, but should changes be made in lot configurations and housing configurations that would result in building residences closer to the highway than we're concerned about. We have significant health concerns.
Yeah, it's like you know, when you do anything, you got to bring it up to the new code. You know, the old code was that this was fine, but if you're going to reconfigure it, guess what? We have more science now, and the science is it's not really a smart idea to be building that close.
Right.
Unfortunately, fortunately, it would only affect, you know, two lots, but it doesn't sound like it's going to affect every single lot on the road, right?
It's a lot. It's 23 lots. It's a lot.
Yeah, it's about
right?
20.
Okay.
It's 20 some odd lots, yes.
Yeah.
But the likelihood of all of those being affected is minimal.
Well, yeah.
I'd be more concerned that somebody is buying up those lots to put in a larger building. These things never happen in isolation like this. If it's one person trying to get a variance, they can get a variance. There's going to be something more going on here.
This petitioner owns 2 lots adjacent. That's, yeah, it's in the assessor's database. I looked it up. So
right.
That appears to be the plan. I mean, I know these are competing interests because we're really interested in housing, but like I see it as like an environmental justice thing. Even if you get affordable housing, I mean, it seems that it was before I was on the board, you did everything you did to get Modera away from the highway, buffer it to protect those folks. I don't really.
We couldn't act in that case because they were falling under, I forget which section it is of Massachusetts law, where they had, because they had a certain percentage of affordable housing, the town couldn't overrule them. That's not the case here.
That was a 40B development. Yeah.
Right. This is, so, I mean, one concern is, are they really going for a 40B that they just haven't told anybody about yet? And that's the real play here. Or if they're not going for a 40B, then we have jurisdiction and we can say, no, you're not going to build this close from a health standpoint if we really want to put our foot down on it. I don't know, but I agree, Ed. I don't know that we really want to wade there. The science is okay. And Kathleen, you probably know it better than any of us, but it's not fantastic.
Yeah, they're narrow. They're very close to the highway. I mean, 100 meters and you still have huge impacts from the highway. So
right.
Traffic related air pollution would be the phrase you'd want to use, Rob. But we can talk about if you need to get up and say something. Anyway, okay, so I don't know what the statement is. Christina, I don't know if you have thoughts on this.
Yeah, I know it's all kind of new to me, so I'm just taking a minute to kind of review things while we chat. But I think what you're saying makes sense in terms of proximity to the highway, and but I don't have a strong position yet, mostly because I don't feel like I have enough information yet to have a strong opinion on it.
We might be best at this point to see what happens at town meeting. And if one of us who's on the Board of Health is there, we could get up and make a statement, depending on which way it looks like it's going relative to our concern about the health effects. But a statement as an individual member of the board and not speak for the whole board.
Mm-hmm.
Okay.
Yeah, I would be comfortable with that.
Ed, since you and I will be there, do you want to together work on a statement?
Sure.
With input from anybody else who would like to provide some?
Sure.
Okay. All right. Moving on, other items from town meeting. Tim, you're on mute.
Sorry about that. There are a handful of items in the special town meeting warrant. Some of them are fairly standard. The property tax assistance program helps residents with limited means. The small repair grant program was one of the outcomes from the Public Health Division's study of housing and transit impacts. Basically, it's small repairs to seniors' homes, including some accessibility or safety enhancements like grab bars for tubs, that sort of thing. It's a sort of a very good program. I don't expect it to have many objections, but I would think the board would potentially want to support it. There are 3 financial warrant articles. One is public health consulting assistance, which did get the finance committee to support. It was actually a lengthy debate, and I need to send you video from it, because I think that the concept was important.
Yeah, well, good. I'm glad they did.
Yeah, well, it was ended up being 5-2, but there were two other votes. It was going to be 5-4. But the board should actually watch it, just because there's a lot of discussion about whether the finance committee would be in position to evaluate when the Board of Health would want to make a request. I think the one thing that I tried to insert, and they didn't sort of pay attention, was it would not be me deciding alone to bring in a public health consultant. It would be the board either me telling the board that I don't think I have the expertise, and the board requesting that we bring in a consultant, or the board deciding it needs additional expertise and telling me to bring in a consultant. That is on the warrant, as is the public information officer for the town, as is the clinical support for law enforcement. I've mentioned it in the past, but Carol and I worked very closely with the police to apply for a Department of Mental Health grant for a law enforcement embedded social worker. There's a number of police departments that have that, and it's a very helpful feature, especially with the rise of mental health cases. The town did not get a grant. There was no opening slots for the grant, but Chief Schlittler was very interested. He was very involved in helping us get the grant ready. He decided to approach Chief Mike D'Entremont from Dedham. They both sort of rearranged their budget a little bit to find money for a law enforcement embedded social worker who splits her time between the Dedham PD and the Needham PD. I think it's a great program. I'd like to have a full-time person. I'd like to have 2 full-time people. But the idea is that this is a co-response model, so that the social worker would go out with a police officer, generally after an event. So the person doesn't go out lights and sirens, but they follow up on substance misuse and overdose. They follow up on self-harm and suicidal ideations. They follow up on domestic violence incidents. And I think there's real value there. It's a demonstrated model that's been proven. There's a lot of communities in Eastern Massachusetts that have it, or not a lot. There's a handful of communities in Eastern Massachusetts that have really done well with this. Arlington is among them. Taunton is among them.
We'll be debating this at the Mass Medical Society within the next week, and there's strong support for this.
Great. Okay. So those are the ones I wanted to bring to the board's attention, that there's a couple of items. The Walker Pond improvements is related to some of the work that the board had talked about, the sewer extension that was done for Walker Pond. This is more of the Concom improvements to Walker Pond, but it is overall the improvement of the water body, which the board does have environmental health concerns. And then the Needham Unites Against Racism resolution is one of the general articles that will be on the town meeting warrant as well. So I wanted to bring those to the board's attention, tell them, that there are certainly important ones for the Public Health Division and the Health and Human Services Division, and just give you a little bit of background on them.
Thank you, Tim. Fortunately, it looks like the Financial Committee is recommending to adopt almost all of them. 1 or 2 to be made at town meeting.
Yep.
Any board members have any questions for Tim about these?
No, I just had a quick question about the embedded social worker. You were saying, so they follow up after an event of some kind?
Sure, because the person is part-time, there's often, and Needham doesn't have the volume of some departments, they're not often on duty when an incident occurs. So the co-response model is generally, at least in Needham, a follow-up the day after. So working with the family of someone who overdosed, giving them resources, trying to get them to agree to be you go into recovery, trying to find them a bed, that sort of thing.
Yeah, I'm just curious how we NPD kind of responds to kind of acute mental health events. If it seems like a great model to have someone, a social worker or mental health professional there.
So Carol could certainly jump in.
I can. Whoop. Sorry.
I was just going to say, my guess, Christina, is this would be a first step towards that, because
exactly.
I would like to see a model where when there's a mental health or substance abuse call that comes in to dispatch, that a clinician actually goes out with police at that first step. We're not there yet, but this may be a step in that direction.
Well, she is and has gone out. Whether I think the difference is going in but her name is Kim Kidders Montoya, and Tim is right. We spent over a year working with Karen Orr from DMH, and the jail diversion model is long established. And the challenge is that DMH never takes the police, the towns off. So they had 13 towns waiting. And so it's really not a grant. And they're trying to change that funding, and Secretary Sutters has put out a new blueprint for that. But to stay on focus, this is a model that by our region, it's advocates in Framingham and then Riverside for our area. And the model is that works best to complement the hard work of our social workers and our public health nurse is to have someone who works for the emergency services DMH program. So the shared funding actually pays for Kim. So she has access to electronic medical records and bed availability in real time, the system that can fast track and support the police, Tiffany and her team, and Jess Moss, the social workers. So it's a whole different level of accessibility. When she's not working with police, she has the goal of making relationships with the people that are persistently in need. So whether she's co-responding during a 911 call or going with the police in between to those folks that have chronic needs, that is the jail diversion model. I think the difference is she's got the radio now, the walkie-talkie. She listens to the calls. So they have become accustomed to her, whether or not she's going in to de-escalate. I think that's the difference. But there's a model and overview on it. And I agree with Tim and Tiffany that I feel, and the police that I know across my town say they would all like to have a full-time person. So.
Yeah. And I mean, I think this is a good start.
I know the board has heard it before, but we do have a well-functioning community crisis intervention team, which does include Carol, our social workers from different divisions in Health and Human Services. It does include a number of the resource officers in the police department and fire department, as well as community partners like Riverside. So we think that's also a very helpful model to try to address sort of co-recurring patterns of, like I said, mental health, substance misuse, self-harm, domestic violence.
I'm sure she and her supervisor would come out and talk to you about the model if you would ever want to, right, Tim? I mean,
I think that's a great idea. Or if the board is interested, I think that's a good idea.
Yeah, no, I think it's a good idea.
That is a good idea. Almost, I don't know if our group ever does this, but I think it would be a fabulous kind of community conversation. I think there's so much interest in this type of thing right now. If she would like to talk to the community about it.
Mm-hmm.
Great. Carol, you and I can follow up offline and work on something for either May or June.
Yep. Thank you.
Great. Thank you, Carol. Okay. Are there any other items anybody would like to discuss? Okay.
The only thing I just mentioned is I think there's one or two folks that's on the board who still need to respond to the doodle poll about scheduling June meetings. The first attempt, we didn't find any sort of overlap. There was always 2 people missing. So Dawn sent out earlier this week 2 new polls.
I may have missed that.
Yeah, I don't think I got that.
So
I think I answered that, yeah.
Okay, I will resend to the board.
thank you.
Okay, so our next regular monthly meeting is May 14th at 9. Thank you, everybody, for participating and for being willing to stay late. And with that, I'm looking for a motion to close.
So moved.
Second.
Okay, we'll go around and vote. Christina,
Yes.
Kathleen,
Yes.
Steve,
Yes.
Ed,
Yes.
and Rob is yes. Okay, thank you, everybody.
Okay, we'll see you guys.
Thank you.
Thanks, everybody. Talk to you later.